All right, good afternoon, everyone. Senate Finance Committee is now in our voting session. All right, which analyst is going first? And I would remind everybody it's hard to hear when our voices are muffled under these masks, so please speak up.
Okay, first bill on your list is Senate Bill 192. This bill concerns the distribution of funds from the Perpetual Care Trust Fund that each cemetery, or not each cemetery, but most cemeteries in Maryland must maintain for the maintenance of the grounds and the buildings. It also deals with how the funds are invested. Basically, it allows cemeteries to choose from either the current fixed income method or a total rate of return. In front of you is a reprint because there's an amendment offered by the sponsor, and it's also the same amendment that's on a bill that has moved out of the House and is now in this committee. If you go to page 3 of the reprint, the bill first specifies at the bottom of the page, you'll see what the trust fund is to be used for. Basically for the maintaining the grounds and the buildings. And on the next page of the reprint at the top, you'll see that the owner of a cemetery can only use the trust funds for those purposes. In the middle of the bill, in the middle of the page is where the changes are to the how the trust fund can be invested. It can either be either for net income to distribute on a monthly, quarterly, or semi-annual basis, or a certain percentage of a total rate of return may be used for the same purpose. It's up to the cemetery to make this choice. If the cemetery chooses to do total rate of return, a series of steps must be taken by the cemetery, and they start on line 17 on down. First, they have to submit to the Director of Office of Cemetery Oversight a statement attesting that they have reasonable expectations for using total rate of return. They have to notify the director at least 60 days before they make this choice, and they have to send a copy of the investment policy to the cemetery director. The cemetery should also notify the trustee. In many cases, a bank in writing 60 days before they want to do this, and it would be the trustee that would make the investments in total rate of return. On the next page of the reprint, at the top, these are further steps required of the trustee. So the trustee has to notify the director annually about the quality of the investment if they're under total rate of return. And then in the middle of the page, you'll see an amendment offered by the sponsor and was also adopted by the House that says that the portfolio should include a reasonable amount of fixed income securities. So the office of cemetery, the director of the office will determine whether that is reasonable or not, but it can't be just total rate of return. The portfolio should also include some fixed income securities. On the next page of the reprint, there's further requirements of their director. In 5 to 7 years, they can review a cemetery's choice of total rate of return and make suggestions or rescind that. And then finally, on the back of the last page of the reprint is a study that in 5 years the director have to study all those cemeteries who elect the total rate of return and report back on how that type of investment is working.
David, how many cemeteries in Maryland, if they chose to participate in this, are even eligible under the definition of those that could?
I think about 100 are eligible to do this of all the cemeteries.
Well, I like the idea of the 5-year report. I noticed that a number of them have less than $2 million in the funds. I mean, they don't have big bucks. Okay.
So we did have I have a letter from or an email from the person who represents a lot of the cemeteries that if it wasn't optional, they would not support the bill.
Okay, is there a motion?
Move favorable.
Okay, any discussion on the motion? All right, all in favor, would you raise your hand?
Finally.
It looks like all of the hands are raised, so that's 9 present. 10 present, okay.
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 The next bill is Senate Bill 461. This bill basically allows medical cannabis as a use under the for purposes of workers' compensation. You have a reprint in front of you with some amendments offered by the sponsor. Some of these are at the suggestion of the Cannabis Commission. Basically, page 2, it specifies that any type of medical cannabis has to be in accordance with Title 13, Subtitle 33 of the Health General article. So basically, you have to have a certificate from a provider who is authorized to provide these certificates. So, well, that's pretty much what it does. It just authorizes medical cannabis as a use under workers' compensation law.
Okay, Senator Feldman
Yeah,
and then Senator
just to
Bidle.
reiterate, this has nothing to do with whether you think that the decision we made 6 or 7 years ago. Hello? Yes, this has nothing to do with whether the decision we made 7 years ago to have a legal medical cannabis program was a good idea or a bad idea. We made that decision 7 years ago. All this bill says, in effect, is if you get pain relief legally, you don't want to go opioids and get addicted, and you want to do your state legal cannabis, that you would have the same parity and get reimbursed for that. Finally, I just say that Chesapeake, our largest workers' comp carrier, no longer is opposed to this bill. For years, they were, not this year. So things have moved, things have evolved. This idea of parity between opioid addiction, pain relief, and your state-sanctioned legal, that's what this bill does. That's nothing more, nothing less. And that's all I really wanted to say, Madam Chair.
Thank you. Senator Bidle?
Thank you, Madam Chair. So my question still is about the federal law, and basically it's in violation of federal law, and we're having an insurance company have to allow marijuana when the federal law says it's it shouldn't be. And I'm on a bank board that we won't do any financing or take any money from any medical cannabis locations because it's against federal law. So that's still a problem for me.
If I might just respond. Well, first of all, that problem of federal law exists right now and has for the last 6 years with the program itself. I mean, the program is in violation of law. The reason the states are moving forward with bills like this are the feds have said we are not going to do any enforcement against state programs like this. There's not a single case where the federal government has done anything in the states that have laws like this. Also, I just point out our own workers' comp commissioners are actually now ordering this as part of, well, there was an appeal in that one case, and the appeal, went for the folks who want this relief. So the federal law argument is true of Chesapeake. It's true of our medical cannabis program. Again, 33 states, and there's not a single case in the entire nation of the 33 states that have these programs, or the 6 states that have that, where the federal government has done anything by way of enforcement. So I got that. We've been living under that cloud since 2013, and I don't think this bill alters that problem. So I hear you. That's really what I would have to
But
offer.
Senator, if you go for medical marijuana now, which I've taken my dad, he's paying for that himself. We're not forcing his insurance company or Medicare to pay for it. This is saying that Workman's Comp, which is an insurance company, needs to pay for this, which is in opposition to federal law. That's what I'm done.
If your same father would go and get opioid for relief, it would be reimbursed. If he doesn't want to do that and instead gets pain relief from another legal product in our state, the idea of some parity, I don't know how else to make that case, is why should he not get reimbursement if that's the product? The fact that he's in violation of federal law, currently, we have hundreds of thousands of Marylanders right now doing this. They're doing it in violation of federal law right now and have been since 2013.
But their insurance company is not paying for it. That's
Well, the
where I'm
one thing
having the issue.
one final point, Madam Chair, the bill, one of the amendments we put in here is that the insurance company shall not pay directly to the medical provider. It's a reimbursement. And one of the reasons we put that in is in the other states, they did it through a reimbursement to the patient as a way to I think the argument is it's not really then, it's a violation, you're not paying it directly to the medical provider, it's through the reimbursement model. There's really less risk of, but again, there's no case in the nation that what you're concerned about has actually happened, but.
Okay, I think we know the issues. Uh-huh.
Maybe more on the other end is we're not required, this bill requires workers' comp to cover it, and I understand why. We're not requiring insurance to cover it, though, correct?
This is a workers' comp bill.
But I'm just saying that, but we don't, but there's no requirement of insurance.
No, this
to
has
pay.
nothing to do with health insurance. This is for workers' comp purposes.
Insurance.
Right.
Right. Well, that's
my
true. Yeah, it is.
question.
It's workers' comp insurance. And the largest carrier in the state, the workers' comp insurers, are not opposed to the bill.
Yeah, but, okay.
Guys, let me just suggest, I think we're hearing good arguments, but we've been hearing them. And the issues are really clear. I don't think we're going to learn anything else from going on. And we got about 20 of these bills to do this evening. So is somebody going to make a motion?
Well, okay. I'll make the motion, and if it's the will of the body to not do it, at least let's get some clarity. So I'll make the move favorable on the bill, and then we'll just take a call and see where it lies.
Okay, it's been moved and seconded. Is there any discussion on the motion? If not, if you're ready for the question, would you raise your hand if you're in favor of the bill as amended?
Okay. Okay. Give it a try.
Okay. All right.
Okay.
Now, what's next?
Okay, the next bill on the list is Senate Bill 830. This bill transfers administration of school-based health center grants from the Maryland State Department of Education to the Maryland Department of Health, specifically the Bureau of Maternal and Child Health. It also requires the Maryland Department of Health and MSDE to develop guidelines to expand the number of school-based health centers in the state. This would, I guess, be consistent with what happened in 2017 when the Maryland Council on the Advancement of School-Based Health Centers was also transferred from MSD to MDH. There are no amendments.
Okay. All right. Any discussion on the motion? If not, if you're ready for the question, all in favor, please raise your hand. All right. Those opposed? Okay, the motion carries.
You already did Senate Bill 883 this morning, so let's move to Senate Bill 907. This was heard last week. It makes a change to the Critical Medical Needs Program. The program reduces barriers for persons with critical medical needs in obtaining energy assistance. As introduced, the bill would have provided that a 60-year-old individual assisted by a navigator would not have to provide a doctor's certification when applying for energy assistance. You have a reprint in front of you. If you go straight to page 3, there's a slight change to that part of the language. And instead of saying they may not provide certification, the office shall allow an individual 90 days after applying for assistance to provide certification. So it would not be immediate, but eventually the medically vulnerable individual who is at least 60 would have to, at some point, 60 days afterwards, provide certification as to their serious medical condition.
Okay. Can we get a motion? We got, all right, we've got a motion and a second. Is there any discussion on the motion? If not, are you ready for the question? All in favor, please raise your hand. If you're in favor, raise your hand. Okay. Senator Benson, are you in favor? Yes. Okay. Okay. All right.
Okay, this is the COVID-19 Testing, Contact Tracing, and Vaccination Act of 2021. The Budget and Taxation Committee was second on this bill, and they voted this afternoon. I've got a reprint. They voted an additional amendment to the bill that modifies some of the mandatory funding provisions in the bill. So if you go to this reprint that you have for Senate Bill 741 and you flip to page 7, what you see that they've done is that they've modified the provisions so that the health department shall only use federal funding allocated under the CARES Act and any other federal legislation enacted in 2020 through 2022 to provide the required funding under the bill.
All right.
Some similar language is included on page 10 starting on page 10 of the reprint that similarly states for the funding provisions relating to nursing homes that only federal funding may be used to meet the funding requirements for the bill. And then finally, on the very last page of the reprint, some uncodified language has been added that says that any funding appropriated for the implementation of the act shall consist only of federal funding allocated to the state under the CARES Act and any other federal legislation enacted in calendar years 2020 through 2022.
Okay. Any, Senator Bottle?
Have a question if this is the appropriate time. So if we're only going to use federal money, are they still required to do the testing, but there's no payment for the testing, or is the testing then not required, like in nursing homes?
So that all the requirements remain. It's just when the testing is covered by the state, they have to use the federal funding for the appropriation.
Wow, thank you.
Any other questions?
On 741 again, right?
Correct.
Which we
Yes.
passed already, and now it's back.
Correct.
I apologize. I was trying to frantically find where we were because it's not on our list, and you said it wasn't on the list. So, why did it come back? Is because there's an amendment for us to consider. Was an amendment from Budget and Tax?
That's exactly right. So the Budget and Taxation Committee is second on the bill,
Okay.
and they voted on the bill this afternoon, and they approved all the amendments that the Finance Committee approved, but they added these additional amendments that I just discussed, which
Okay.
modifies the appropriation provisions in the bill.
So how much money do we end? What's the fiscal note now?
So I think the fiscal note remains the same. I think the fiscal note assumes that federal funding will be used to cover these testing costs. But there was some additional funding, the provisions in the bill said that if the federal funding was not sufficient, then general funds must be used. But the estimated funding required to cover the cost of the bill remains the same.
So now with the amendments, we're just saying it's all going to be federal funds?
That's right.
And if we don't well, we have federal funds, right?
Correct.
Although we don't know we don't have any control over how those federal funds get spent, do we? Or do we?
So from what's been communicated from some of our budget analysts is that there is a lot of federal funding that is being allocated to the state for testing, for vaccines, for contact tracing. I think the estimate was in the range of $800 million coming to the state in the most recent Biden stimulus legislation. I think there still will be a need to see if there are any conditions attached to the federal funding. That's probably the one issue that remains. How much flexibility does the state have
So
in spending those funds? But yes, there is federal funding that's coming to the state for these purposes.
well, it's good news that there won't be state tax dollars used, although it is all taxpayer dollars, but it's good news there's no state tax dollars that necessarily have to be used with this. But question for you is, isn't it a mistake, a question for, not for you, no offense. The question for us, I think, is it, I go back to, is it a mistake to be so prescriptive in a bill going out a year and a half? I mean, we're even putting in stuff in here about workforce. I mean, can federal funds go to employ like a whole new, I mean, I assume they can, but I mean, what if the federal funds say you can employ more people, but there have to be these qualifications, I mean, there could be procurement rules.
If I could just.
I still wonder why we're doing this all at once in a big bill like this.
Because they have put money into so many different categories, all mixed together, and the state, we'll be out of session by the time the state figures it all out in terms of everything they can do with it. But they have put in billions coming to the states, and it's quite a mishmash.
Back in this bill by May 1st, so we'll be out then.
Well, all they
So-
can do then is tell you for sure where it could all go. So the thing is, do we want, if the money is here, given all the needs of the state, to be able to accept it and to use the funds?
Well, but
Or do we want to not have anything to say about what happens?
I don't mind having something to say about it. I just feel like we're being, I mean, I've made my point. I think we're being very prescriptive. And I also, candidly, I'm a little nervous about putting something in and saying we're going to have surveillance testing at universities and at private businesses and requiring contact tracing for the next year and a half.
Congress did have that as a line item in what they are sending us. So you could decide if you want to use it or you don't.
I understand. I think putting a policy in place where we're talking about doing contact tracing next spring.
Well, the worst that could happen, I think, is that some of the line items might not turn out to be useful or used.
I'm saying also more as a policy, though. Do we want to be saying that we're going to continue to treat that COVID hopefully will be, we're seeing the numbers go way down. We will always probably have it with us to some extent. Are we saying we want to set up a structure that in next March, if with much smaller numbers, hopefully,
It's not going to be
no
smaller.
outbreak?
With
We're gonna be-
everything opening up right now, you wait a few weeks.
Well, okay, but again, we're really locking ourselves in here, and I just don't think the policy of the state ought to be, I don't think the policy of the state ought to be that we want to continue in this rigorous of a system for sure for the next year and a half. That's my opinion. I mean, that's,
Okay.
yep.
Senator Hayes.
Thank you, Madam Chair. Patrick, the proposed amendments that budget and tax, are those the ones that you've outlined?
Can
in,
you
like-
speak up?
The amendments that budget and tax pass, are those the ones that are highlighted in the black box that you circled on page 7 and page 6, I think, 9?
Yeah, that's right. So Budget and Tax approved all the additional amendments that the Finance Committee already approved, but the amendments that are new, that Budget and Tax added on in addition to the finance amendments, are the ones that are boxed in and marked up in the reprint, yes.
Got you. I guess in a rare moment, I'm in agreement with my seatmate here. It is a tad bit prescriptive in that it identifies the nursing homes, the living facilities, which we all know definitely should be prioritized, but have been prioritized thus far, right? And the money should be coming down. I wonder, like, what effect that may have. So there may be some language, and I'm hoping you can help me with it that alleviate my concerns. It says to the extent practical. So when it has that type of language, and maybe Vice Chair is a lawyer or whatever, just like legalese stuff, does that mean they will make their best effort, but if there's other needs, they do have the flexibility, like, say, the hard-to-reach population? Would that alleviate whatever concerns I'm having about it being so subscriptive and identifying just like the nursing homes and stuff like that?
Yeah, I mean, that's right. You know, that language offers a lot of flexibility in the
Okay.
funding requirements.
Excellent. Thank you so very much.
Senator Augustine?
Thank you, Chair Kelly. I just want to reiterate why we are at this point. It's because there has been no plan from the state of Maryland. That's the reason why we've had them come and talk to us every single week. And so that's the reason why we felt there was an obligation for us to set a framework for a plan for this COVID-19 pandemic since it hasn't occurred. So yes, it is prescriptive. If there had been a plan over the last year, something that's been consistent and shown a clear pathway, we wouldn't have to have done this. But that just hasn't occurred. That's why we have this legislation here. That's why I'm supportive of it.
to respond to that for
Senator Reedy.
one second, because I understand that sentiment, and I'm not saying I totally disagree. In fact, I would argue what we ought to do is maybe get out of the state of emergency soon so that we can, go back to more of a regular order, and I mean that across the country. But at the same time, you say there hasn't been a plan for the last year. In fairness, for the first few months, everybody has been scrambling to figure out how to handle all this stuff. So, and I think to think that we're going to now, we have at least an idea of what we want to do and put a plan together. But the idea that it's just going to be the same for the next year and a half, I mean, hopefully it's going to be a lot less. Hopefully it's going to be more of a thing where people will get it some, and there might be occasional spikes in different places. And certainly we want to be nimble and say, hey, if there's a spike, particularly in a heavily populated area, we want to get resources there. But we're requiring every county in the state in this bill to have a plan that's very specific, that it's sort of a one-size-fits-all, but every county's got to have it, and it requiring plans for all sorts of different entities, including private businesses, to have contact tracing and surveillance testing. I just don't.
Well,
I don't think
that's
we need
what
to be
they-
requiring that. I mean, I know I'm saying what I said, but I just, I mean,
That's what the
I get your
feds-
point. I do. I mean, yeah.
Gave us money for. So you decide if you want it or you don't. All right. Did anybody make a motion?
Why don't we just take a roll call?
Did-
You're going to move the amendments?
All right.
You got to move the amendments.
All right, so Senator Benson is moving the amendments and Senator Bidle is seconding. All right, raise your hand if you, well, do you want to, okay.
Amendments,
Yeah, on amendment. Okay. Okay. Okay, that's everybody. All right, now on the bill as amended, can we get a motion? Okay, got a motion and a second. All right. If-
Roll call.
This is what I'm, all right, let's call the roll this time. Okay, Tammy.
Senator Feldman,
Aye.
Senator Klausmeier.
Yep.
Senator Benson.
Yes.
Senator Kramer.
Yes, ma'am.
Senator Hayes.
Yes.
Senator Reedy.
No.
Senator Augustine.
Yes?
Senator Bidle.
Yes.
Senator Hershey.
No, thank you.
Madam Chair.
Yes. Okay. All right. Okay, where are we now?
Okay, moving to the list, Senate Bill 97 is the next bill that will be before you. This is the Purple Line Marketing Act. This is the bill that would require the Maryland Transit Administration to develop and implement a Purple Line marketing plan. Among other requirements, the plan must identify interconnections with other local and interstate transit systems, as well as pedestrian and bicycle access to Purple Line stations. Senator Rosa Pepp has offered an amendment that's in this reprint that's in front of you that would modify a requirement that the governor include in the budget bill an appropriation of $500,000 from the Transportation Trust Fund for the development of the marketing plan that's required under the bill. The amendment he's offering would state that for the fiscal year that's preceding the calendar year in which the Purple Line is scheduled to open, the governor must include in the budget bill an appropriation of $500,000 from the Transportation Trust Fund. That's different from what the bill says as introduced, which requires this appropriation in each of fiscal years 2022 and 2023.
Now, I'm worried about the fact that the essential workers in the Baltimore region can hardly get to work. And as more of these jobs open up, they have cut down the transit service. People are needing to wait an hour and a half sometimes for a bus. And when they start having the kids go back to school, remember they aren't school, but worry me if this is the source. And I'm talking about what Rosa Peppers, his amendment. Senator Augustine?
I'm just trying to understand what you said, Madam Chair. I think that the amendment moved the year so that it would not be as close. It's like now it's preceding the calendar year in which the Purple Line is scheduled to open.
It's so close, though,
No, actually, it's not. I
We're
wish it
in-
were.
And I'm simply saying, as things open up, the essential workers in the Baltimore area are they took away half the infrastructure they had, and it wasn't sufficient.
So, I
And do
understand.
you guys remember when we went to the Port of Baltimore a year ago, and they told us it took 2 hours for a lot of their workers who lived in Baltimore City to get there, so they were hiring people from Delaware who could drive there and get there quicker?
Yeah, I do remember that, Madam Chair, but I just want to share with you, as someone who has the Purple Line in my district, it is delayed, and that's part of the reason why this date is on here. We're in the midst of trying to get the contractor squared away, and so I don't think it's going to, that's the reason for the amendment, because it's going to, unfortunately, it isn't going to be right away. So I believe that the way this amendment comes in, it should not negatively impact the money for the folks of Baltimore and all the essential workers that you're talking about in the near term.
If I were seeing a stream coming to Baltimore for mass transit and some kind of a reasonable plan, I wouldn't worry. But if this comes in the next 5 years, it's a problem to me. Senator Hayes.
Patrick, did you explain, did Budget and Tax weigh in on this one?
Yeah, so he did run the sponsor did consult with Budget and Tax, and they were fine with it.
Right. And I think for Augustine clarity, I'm assuming what the chair is referring to, it does show that it will have an impact.
People
on
are
it.
listening in.
Oh, I'm sorry. I got to get closer. Can you hear me now?
Yes.
I apologize. So that's what it is. It's the mustache. I think, what the chair is saying, and there's definitely, some conflict, but I guess if Budget and Tax had a chance to see it, there's legislation currently, and if you look at this fiscal note, it does have an effect on the Transportation Trust Fund. I'm not as clear on what the timeline is, but I'll take the senator's word for it that things are running behind. But I know the legislature is currently contemplating legislation to address some of the ongoing maintenance issues of MTA, and regardless of when it happened, this would definitely have an effect on that funding.
Okay, well, I think we all know where we are. Senator Augustine wants to respond.
I don't disagree that this is legislation that looks to support the Purple Line and the communities, including the ones that I represent, that have been hurt, that actually have a significant number of essential workers, Madam Chair, some of the greatest numbers in the state, actually, in Langley Park, quite frankly. And they need, just like everybody else does, I'm supportive of Baltimore and Transportation Trust Fund, making sure it happens, but I think that this has been thoughtfully put forward, and I would move favorable as amended.
All right, we got a motion. Is there a second? All right, Senator Vital is second.
Of course, people gonna
Are you
jump
ready
on
for the
opportunities.
question? All right, all in favor, please raise your hand. All right, those opposed? Okay, motion carries.
The next bill on the list is Senate Bill 748, Public Health State Designated Exchange Clinical Information. This is a bill that requires a nursing home, on request of the Maryland Department of Health, to electronically submit clinical information to the State Designated Health Information Exchange, which is CRISP. The exchange may provide this information to healthcare providers, federal and state officials, and other specified entities. If approved by the Healthcare Commission, the information may be combined with other data maintained by the exchange to facilitate a state health improvement program, mitigation of a public health emergency, and improvement of patient safety. The bill also requires an electronic health network to provide electronic healthcare transactions to the Health Information Exchange for certain public health and clinical purposes. Senator Beidel is offering an amendment here. These amendments would conform the bill to the House cross-file with the amendments that have been adopted over in the House. If you go to page, there's a reprint that follows the amendment, starting on page 2 of 5. There's some definitions that have been adopted into the bill that would clarify the scope of electronic health networks to which the bill would apply. And then on page 3 of 5, there's some language that would say that the information submitted by a nursing home under the bill may be used only to facilitate the objectives stated in the bill and may not be used for any other purpose, including licensing and certification. This language is in response to some concerns initially that had been raised by some of the nursing homes. In addition, in the provisions that relate to the electronic health networks, there's language that would state that an electronic health network shall provide electronic healthcare transactions instead of administrative to the state-designated exchange for these public health and clinical purposes, the State Health Improvement Program, mitigation of a public health emergency, and improvement of patient safety. A fee provision has been modified so that an electronic health network cannot charge a fee to a healthcare payer for providing the information. And it's currently the case that the Healthcare Commission may adopt regulations relating to limiting redisclosure of financial information, restricting data of patients who've opted out, of record sharing through the exchange, and restricting data from healthcare providers that possess sensitive healthcare information. Instead of this being something that they may do, the amendments would require them to adopt these regulations.
Okay. Any reaction and emotion? I didn't hear. Okay, remember all of us, the public is listening in. I can barely hear you, so they can't hear you. Okay, Senator Beidel.
On the amendments.
Okay. All right, we got a motion with a second. All right, any discussion on the motion? Okay, if not, are you ready for the question? All in favor, please raise your hand. Looks unanimous, doesn't it? Okay. Okay, the motion passes. Let's see.
Next bill on your voting list is Senate Bill 815, Mental Health Facilities, Sexual Abuse and Harassment, Reporting and Prevention. Senate Bill 815 requires, I'll go through the reprint that's before you, starting on page 3 of 5. With the amendments, the bill requires a licensed residential treatment center, a state facility, or hospital with a separately identified inpatient psychiatric service to report a complaint of sexual abuse or sexual harassment of a patient within 24 hours after receiving the complaint. The complaint must be reported to the Behavioral Health Administration and the Office of Healthcare Quality, the Child Protective Services Unit in the Department of Human Services if the complaint involves a minor, and the State Designated Protection and Advocacy System. The bill also requires that these facilities implement certain actions relating to the prevention of sexual abuse and sexual harassment, such as an adoption of a written protection plan as a part of a patient's treatment plan. The amendments are, as I described, on the bottom of page 3 of 5. The Behavioral Health Administration and OHCQ must collaborate to develop and implement a uniform reporting system to be used by facilities in complying with the requirements of the bill. think I've covered mainly all of the amendments. You'll just see on page 3 of 5 that the requirements to adopt these protective measures applies to all these facilities and not just the state facilities.
The report that has to be given may be oral or written. Are we satisfied, if it were oral, it ought to be followed up with written, wouldn't you think? See, there's something in the record. I'm looking on page 3 of 5, right here in the middle, line 15, 14, lines 14 and 15.
This relates to the provision that says a person or an employee, a current law provision that says that a person or employee of a facility or the department who receives a complaint of abuse or who observes or has reason to believe that the abuse has occurred must promptly report the alleged abuse to an appropriate law enforcement agency or the administrative head of the facility, and that this report may be oral or written and contain as much information as the reporter is able to provide.
I would think the police would do a written report. Is that what you're saying, Patrick?
Even if maybe within 24 hours, there
No, I
must
mean,
be
if-
a written report.
Wouldn't you, if you
You
talk
won't.
to a police officer, wouldn't you give him the information or her the information and they would take it down and write it down?
But when it says it may be oral, the report may be oral or written.
I mean, I understand what you're saying.
Shall contain as much information as the reporter is able to provide. Yeah, so you're talking about not the document. I just think that's a little weak right in there, but okay, if nobody else has a problem with that. Senator Benson.
Yes. In the case of, if an individual is charged with a sexual abuse or harassment, and it is found that the charges are unwarranted, is there any language that says that this should not be a part of a person's permanent record? Or what happens in that particular case? If they're cleared,
Well, you're broadening the scope of the bill.
is there any,
Yeah.
what happens in the case that a person is charged with sexual abuse or harassment, and it's found there's no merit to it, it's not true, and they've gone through the process? What happens in that case? Does that become a part of their permanent record, or what happens?
You know, I don't know the procedures that take place after a case has been reported and it's been adjudicated and the person has been cleared of any of the allegations. I mean, I think the scope of this bill is
Limited.
about who is supposed to get information about a complaint when it's made, and then what happens with that thereafter. That's really kind of within the scope of another bill. But you know, I think that they certainly would have due process protections to ensure that, you know, they would be able to have their record reflect the outcome, the disposition, you know, of the case that was brought. But if that's something you'd like me to follow up on more fully, I'm happy to do so.
Yeah, I just become a little concerned because these are serious charges, and if it's found that they didn't commit sexual abuse or harassment, you know, I'm just worried a little bit about what happens to that information. Is it because it can interfere with their job possibilities and the future and all that other stuff? You know what I'm saying? But this bill doesn't address that.
Correct.
All bills have to have a border around them at some point. And this one is really dealing with how to do the reporting and what must be reported. It's probably in a law somewhere, in Health General or somewhere, what happens altogether if anybody makes a report of anything in a number of different settings, healthcare settings, and if it turned out not to be validated or something. Okay, can we get a motion on?
I move favorable on the bill.
Okay, can we get a second? Okay, it's been moved and seconded. Any discussion on the motion? Not, are you ready for the question? All in favor, please raise your hand. All right, that's everybody here. Okay, the motion carries.
Next bill on the voting list is Senate Bill 923. This is the bill that would require Medicaid to extend coverage for eligible pregnant women with family incomes up to 250% of the federal poverty level for 1 year immediately following the end of the woman's pregnancy. The current law provides coverage for women for up to 60 days postpartum only. This extends that coverage to 1 year. There's an amendment that the sponsor of the bill is offering that would include dental in this coverage, and also that would strike some provisions in the bill relating to the development of materials and the adoption of regulations concerning disenrollment from Medicaid.
Yes,
So
Senator
does the,
Sullivan.
what's the addition of dental, what kind of a impact does that have?
I think it increases the I think the health department in their letter had an estimate. It would, with dental, the total cost of the expansion would be $16.9 million from 15.6. So I think the amount of general funds that would be increased is about 500,000. That's the estimate.
Well, I guess I'd ask the same question that Senator Malcolm Augustine asks all the time. I mean, do we, for this additional, well, just generally speaking, is B&T signed off on the bill as, do they know about this amendment for another 500 or a million or whatever?
Yes, B&T has signed off on this. This was a bill that was put before the chair of B&T, and it included information about the amendment that would include the coverage expansion with dental.
Okay, well, with that, Madam Chair, I'll move favorable.
Okay, we've got a motion favorable. Can we get a second?
Second.
Okay, any discussion on the motion? Not, or if you're ready for the question, all in favor, please raise your hand. Okay. That's 10. Thank you.
The next bill for discussion is Senate Bill 163, Senator Ellis's bill. Under amendments offered by the sponsor and reflected in the reprint in front of you, Senate Bill 163 establishes a doula pilot program for 3 years from June of 2021 through May of 2025. The pilot program applies in Baltimore City, Charles County, and Prince George's County. The program must cover at a minimum reimbursement for up to 4 prenatal and 4 postpartum visits, as well as support during labor and delivery. Participating doulas must have received certification from one of 4 entities specified in the bill. The Department of Health is also required to conduct an evaluation of the effectiveness of the pilot program. The amended bill is a leadership priority and implements recommendation number 9 in the health disparity section of the report of the Senate President's Advisory Work Group on Equity and Inclusion.
Okay, we got a motion. Can we get a second?
Second.
All right, it's been moved and seconded. Any discussion on the motion? Not. Senator Reed.
So generally, I've got no objection to the overall aims of the bill as stated. I am concerned or wondering if there's some very specific things with, there's actually a whole program in Baltimore that talks about abortion doulas. And I've been looking at it online. And so a question here is, it seems to me this is saying that it's providing coverage for doulas for pregnancy, postpartum, and correct, like pre-pregnancy, pregnancy, all the way through postpartum. I'm just trying to figure out if a program being run by a nonprofit that says we're going to help counsel women through their abortions, would that be eligible for these kind of funds? For this program?
It was not a part of what.
I know it's not spelled out in the bill, and I don't think it's even the sponsor's intention, but I'm just trying to find out.
I can't speak specifically to that concern. The department is required to administer the pilot program under the bill. What was that? Okay. So as to any specific activity that would be covered under it, what you described, the four prenatal, postpartum, and then the assistance during delivery, those are the minimum requirements. The department could certainly include to cover other services should they decide to do so. I would point out that the doulas need to be a participating doula and hold a certain certification, but that it's
They
not,
can't be volunteer like we do this for. Yeah, right.
Okay, Senator Bidle and then Senator Hershey.
Madam Chair, so I have a question for council. You just mentioned that they have to have a certain certification, but the opposition from MedChi says that that's what they need, that they should create a regulatory structure for doula certification. So is there a certification or not?
I'm not, so did MedChi send additional information? The amendments are strike the bill in its entirety and substitute the pilot program. And so in order to be a participating doula under subsection A2, the individual has to have received certification from one of four specific institutions that are listed there.
Thank you.
All right, Senator Hershey and then Senator Hayes.
Yeah, thank you, Madam Chair. I was going on the same line of questions if this addressed MedChi's concerns. So are you saying it does just because they struck the whole bill and they made it a pilot?
I have not returned to MedChi's letter to compare it to the pilot program.
But it's not a part of the bill in its present posture.
Okay, thank you.
Senator Hayes.
I just wanted to add clarity to those two questions. So I'm not even sure if there's an official certification as it relates to a doula, and that's probably what MedChi was raising. But there is currently a certification in the state for community health workers, and community health workers are often also serve the purpose of a doula.
Well, whatever it would be, you're creating a pilot, and so they'll have to shape the whole pilot. The parameters of the pilot aren't here. It's to be shaped. We're just for a limited period of time to see what will happen and if something is workable. Okay. So do we have did we get a motion? Okay. And Senator Pellman seconded. All right, any discussion on the motion? If not, all in favor, please raise your hand. All right, those opposed, raise your hand. Okay, so it's 8-2. All right, thank you very much.
Next bill is Senate Bill 651. Senate Bill 651 alters the definition of public safety employee as it applies to workers' compensation benefits to include Baltimore County correctional officers and detention officers. There was no opposition. The bill passed the House 122 to 10.
All right, it's been moved and seconded. Any discussion on the motion? Not, if you're ready for the question, please raise your hand if you're in favor. Okay, that looks like it's everybody. All right, thank you.
Senate Bill 705 is next. Senate Bill 705 requires the Maryland Aviation Administration in carrying out its powers and duties with respect to rental vehicles offered by rental companies and peer-to-peer car sharing programs do four things. One is treat services as treat like services being of the same class, provide services and privileges consistently, ensure the agreement terms are reasonable and uniform, and to consider the Aviation Administration's long-term investment in the consolidated rental facility. The bill provides additional specificity to the definition of commercial activity that includes the offer or agreement to rent a vehicle by a rental vehicle company or a peer-to-peer car sharing program as specified. The amendment offered by Senator Beidel makes a technical or clarifying change on page 3, and then on page 5 establishes that the Aviation Administration's authority over commercial activity at BWI extends to a commercial zone within a 7-mile radius of the main terminal and requires MAA to establish rules and requirements for the conduct of airport-related commercial activity within that commercial zone.
All right, Senator Hayes.
Yeah, Madam Chair, I wanted to ask that we hold on to this bill. I'm sorry, I got to speak into the mic. I wanted to ask that we hold on to this bill. I know the House is trying to do a work group, and there are some other concerns associated with the bill.
Okay, you are willing to hold it? Okay, we'll hold it. You think another day? Senator Hayes, you think a day is sufficient? You know, we're getting right to crossover. You gonna push them?
Yeah, I'm sorry, I was trying to wait till the mic came on. I'm not sure how soon they will be coming up, but I know they're in the process of doing a work group. Also, you know, this is really, you know, I don't want to put this committee in a precarious situation where we may be positioned as if, or present as if we're taking sides in an ongoing, you know, back and forth. I think the House is trying to do their due diligence as sorting through and coming to a fair resolution. Also, there was a pretty revealing House committee hearing on, you know, a bill that I sponsored around providing opportunities for HBCUs that brought to light some pretty embarrassing and damaging information that I wouldn't want this committee to go to the floor and have to defend.
What about if I say we'll hold it 2 days? Then you can go back and tell them, we're holding this 2 days waiting, but I mean, with crossover coming.
Yeah, and that would give us an idea of how far the House along.
Okay. So, Senator Hershey?
Madam Chair, I was just going to suggest that we just hold this until the next voting session. I mean, we don't have to do what the House does. You know, as one of the co-sponsors, I think with the amendments, this honestly is ready to move forward. It's about time we take a position on this, but I will say if he wants to, you know, my colleague wants to hold it for the next voting session, that's fine, but I wouldn't want to have to just hold this until we just see what the House
At
does.
the rate at which stuff is coming up, and with the limited time we have, I think 2 days is good, if you guys agree. Senator Bottle?
Madam Chair, can I just add, it's my information that the House is looking at the taxes, which isn't this bill, that's a different bill.
Correct.
They're not looking at this bill, the airport's requesting, because they don't have a category to put in a contract, a vendor's agreement in with the car rentals. So they need this, but my information says the House is only looking at the taxes, not at the airport bill.
Okay.
Is that, Senator Hayes, do you know something different than that?
Yeah, I know that they're looking at the differences between the peer-to-peer and the car rental industry and all of the issues that's associated with it.
But it's the taxes that are being charged.
That's a large part of it, yeah.
And that's a separate bill.
It is a separate bill, but there is also issues as it relates to these two. I like to avoid not, like I said, I like to avoid not embarrassing this committee on the floor with some of the contentious issues that have been raised and questioned about the two companies that we're considering.
Okay. Well-
Could you agree if we can get to it in 2 days and vote it?
I think the next voting session, because it's important to the airport, to the MAA, that's who we're talking about. The MAA is requesting this, so thank you.
Okay. All right. All right. All right, so we're going to 7:14? Okay.
Yes. Senate Bill 714 makes various changes to the regulatory structure governing 911 in the state. Changes are related to system outages, the 911 board composition and responsibilities, and authorized use of the 911 trust fund. Additionally, as amended, the University System of Maryland, in consultation with the Workers' Compensation Commission, the 911 board must study workers' compensation law as it relates to 911 specialists. The amendments are primarily those alluded to by the sponsor at the hearing. They address certain industry concerns related to the treatment of service outages. That provision is found on page 3 of the reprint. There are also compromise amendments developed by Senators Hayes and Kagan that on page 6 specify that the board's responsibilities include recruitment projects designed to reach minorities, and on page 11 requiring the 911 Commission to provide certain information and a plan to provide implicit bias training to 911 specialists. As amended, I understand there is no opposition.
All right, Senator.
Nathan, I just underlined it here on the first page. But the, Allman said that they do not have the expertise to be part of the consultation with their study. Maybe I'm missing it.
So
Says
the
University of System, on line 21, University System of Maryland in consultation with the Workers' Compensation Commission. They don't do that, he said.
So and this was addressed, this came out in some questioning at the hearing that
Right.
at the time, as introduced, it was the Behavioral Health Administration within the Department of Health. Now the University System of Maryland is going to be responsible for conducting the study. The in-consultation provision related to the Workers' Compensation Commission would likely be information only, is my understanding from the sponsor. That they would, if questions were sent to the Workers' Compensation Commission as it pertains to procedural
Yeah.
things
Can
like
we
that.
put that in there for information only?
I suppose so.
Yes, please. I think we need to do that because, I mean, they have those cases every day. I mean, that's what they do.
And I think that that's why the commission was going to be consulted, is because that is what they do. So you would like there to be an additional amendment that says, in consultation with the State Workers' Compensation Committee for information purposes, because that's typically what
That's kind of
institutions
Okay,
provide.
That's fine.
Okay.
That's fine.
Okay. Okay. Then can we get a motion on this?
Move favorably.
Okay. Any discussion on the motion? I guess we discussed before we had the motion. All in favor, please raise your right hand, or one of your hands. Put up one. Okay, that's unanimous. All right, thank you.
The next bill is the first of a slate of unemployment insurance bills, the first being Senate Bill 771. This bill expands the applicability of the work sharing program within the unemployment insurance program. The amendments remove paid interns and apprentices in response to some guidance that was received related to federal program requirements. The amendments further clarify that a specific COVID-19 related provision is also subject to flexibility provided under federal guidance. The amendments remove a provision establishing the goal of the program of 4% of work share as a percentage of all claims, and finally authorizes the use of Relief Act funds to market the program. These amendments were also adopted by the House. The cross-file passed the House by a vote of 137 to 2.
All right, we've got a motion and a second, and a discussion on the motion. Not, are you ready for the question? All in favor, please raise your hand. All right, okay.
The next bill is Senate Bill 816. This bill expands the requirement that the Secretary of Labor offer payment plans to employers at all times, not only when the state is in the highest tax table for unemployment insurance taxes. The amendments in the reprint in front of you clarify provisions of the Administration's Relief Act and were created at the request of the Department of Labor. They're related to the deferral of certain tax payments by certain employers with fewer than 50 employees. Currently, the Relief Act deals with and allows for the deferral of certain reports rather than the deferral of the actual payments. The Department of Labor is advised that they need those reports in order to determine how to handle claims. So these amendments were also adopted by the House. The cross-file passed the House unanimously.
Okay. All right, we got a motion. Do we have a second? All right, it's been moved and seconded. Any discussion on the motion? If not, are you ready for the question? All in favor, please raise your hand.
Are you with everyone?
Okay.
The next bill is Senate Bill 817. This requires the Department of Labor, in consultation with the Department of Legislative Services, to study and make recommendations regarding reforms to the unemployment insurance system in the state. The amendments consolidate study requirements included in Senate Bill 893 to expand the topics examined and require the department to consider any report issued by the National Academy of Social Insurance Unemployment Insurance Task Force. And these amendments were also adopted by the House.
All right, Senator Feldman has moved favorable in a second. All right, it's been seconded by Senator Klossmeyer. Any discussion on the motion? If not, are you ready for the question? All in favor, please raise your hand. Okay, that passes. Okay.
Next is Senate Bill 818. This establishes various reporting requirements for the Department of Labor, including weekly and monthly posts on the department's website. The bill also requires the department to report to the General Assembly during a disaster in the unemployment insurance system. The amendments add a requirement for the department to post certain information on the website weekly and modify requirements related to staffing during a disaster. Those provisions can be found on page 4 of the reprint. The amendments also alter the on-off trigger for the disaster reporting requirement. Similar amendments were adopted in the House, but the amendments here differ slightly in the specifics of the on-off trigger. In this version before you, for purposes of the section related to the disaster reporting requirement, a disaster exists if the department for 4 consecutive weeks fails to pay at least 82% of first payments within 21 days. And then the disaster triggers off when the department for 4 consecutive weeks is paying claims with 87% within 21 days.
Madam Chair?
Yes,
So,
Senator Feldman.
Nathan, explain specifically why we chose to, even if it's slightly, modify things so that it doesn't conform with
So as the House passed the bill, the on trigger was reaching 6% of insured unemployment. We were subsequently told by the department that we are not there currently, that with specific to insured unemployment. Additionally, there was the problem that, so while the House had 6% unemployment as the on trigger, the off trigger was reaching 80% of claims being handled within that 21-day period. So there was sort of a disconnect between the on-off trigger and that they weren't measuring the same thing. Here in the Senate version, we're only using the ability to pay claims in a timely manner to trigger on and off the reporting requirement. And it also seemed prudent because the reason that we want this reporting requirement to kick in would be in situations when members were facing questions from their constituents, and it seemed that logically the members would be facing questions from their constituents when the department was not able to pay them quickly.
Madam Chair, with that very thorough explanation, I'll move favorable.
Okay. All right, it's been moved and seconded. Any discussion on the motion? Senator Hershey.
Nathan explained it too well, unfortunately, for me to rebut it. But I did talk to Labor today, and they much preferred the House amendment with the 6%, only stating that if this were to go into effect like in the condition that we're currently in, it triggers automatically. And their concern was that this obviously was not a recession, but a pandemic that got us to this point. And going forward, once we got out of this, the trigger point would be better, or the matrix would be better if it was the 6% and not that. Did they have that conversation with anyone?
Let me just respond this way. It is a catastrophic situation, and it isn't the making of the department or of anybody. But one of the additional problems is that at this point in time, we still aren't straight. And Nathan has said you need the on and the off trigger to match, to be at some point of contact. And we don't have that in what the House has done. There can always be changes one way or the other, but I think it's such important legislation. And things are so bad right now, and even with the federal funds coming, and with us finding out that people who live in Kentucky are getting checks from UI that say they're for somebody in Maryland and vice versa. I mean, things are really messed up. I think we need to have more hitches and zippers to make sure when we do something, because it's not just a Maryland problem. We can see that nationwide this thing is out of control. And I think we need to be sure that the on and off switches match. Just my thought.
Oh, sorry.
I've had several occasions to talk to the department, and they have not mentioned that to us, have they? I don't.
Senator Felmer.
Yeah, I guess I would like, maybe if you could respond to Senator Hershey. I mean, again, we're going to be sending it back over in a different posture, and this seems to be not unimportant.
So the department did not contact me to raise this objection. I've heard other information from them in recent days, but I can say that based on information that I have seen, at only 5 times in the last 9 years has the department ever reached this 82% level. And based on, again, the information that I saw, never was it for a sustained period of 4 weeks. So I cannot actually identify a situation where, historically, this reporting requirement would have triggered on. It certainly would now, because of the circumstances we find ourselves in.
Okay, Madam Chair, I'm going to renew the motion. If the secretary, I do think there was an obligation to at least reach out to council, or and I appreciate reached out to Senator Hershey.
You know what? If they were doing a good job, the whole world is in a mess, and the state's in a mess, and with regard to this, the folks helping the department are in a mess, and I think we need to fix it.
I just want to clarify, I was talking to them about a different issue that we've been talking about broadly, and it came up this way. So I don't want it to appear that they just contacted me on this and disregarded everybody else. We were talking about something else, and it happened to come up.
All right, Senator.
Now, you know what? We have worked very, very hard on this, and this is what the UI Oversight Committee came up with, and I have not heard from them, and I just think it's time to just move these. They have to go because...
Motion I made, that would be a good place to start.
You want to second the motion he made?
I did second, and I'll first it too.
Okay. All right, any further discussion on the motion? Senator Hayes? Okay, all in favor, please, raise your hand. Okay. All right, that carries.
Sorry, Tammy, I turned it off. Senate Bill 819 increases the income disregard used in calculating an unemployment insurance claimant's weekly benefit amount for the duration of the state of emergency related to the COVID-19 pandemic. The amendment reduces the disregard to $200 as compared to the current amount, which is $50 under current law, $300 as the bill was introduced. This amendment was also adopted by the House.
Okay, can we get a motion? All right, Senator Feldman moves, Senator Klossmeyer seconds. Any discussion on the motion? All right, all in favor, please raise your right hand, or it's one hand.
Senator Reedy, are you good?
Okay.
Senator Reedy, are you good?
Okay. Okay. All right, we'll go on to 893.
Senate Bill 893, as amended, establishes various requirements for the Department of Labor in administering the unemployment insurance program. As amended, the bill also, one, facilitates information sharing between the Departments of Labor, the Department of Health, and the Health Benefit Exchange. It requires the opening of a special enrollment period to be established to help UI claimants obtain health insurance coverage. Requires the Department of Labor to provide certain data to the chief elected official of a county. This provision is related to the utilization of the workforce boards. And four, address issues with overpayment of benefits. The sponsor of the bill provided an amendment that largely aligns the Senate and House bills with the exception of the information sharing provision. The House bill is currently past second reading.
All right, all right.
I'd like to know if I could have a one-day hold on this, and I'll explain why if anybody cares.
Yeah, since the House bill is past second reading, can you explain why?
Well, yeah, it sounds like we'll be fine to get it for, it sounds like there's not a rush, but no. There's, number one, I have an amendment I'd like to prepare to offer. And number two, I think I'd like some time to read over this in the amendments, and I don't want us to hold out here, but this is a big, big bill. And again, it's another situation where, in this case, I understand why we're being so prescriptive, and I get it, but it's a big policy. And I have to be honest, we're throwing a lot of big policy bills out on the floor to try to deal with problems, and I feel like it would be good to have a day with this. But I also would like, there's an amendment that I'd like to prepare on a specific issue.
How long would you like us to hold it?
Just till the next voting session is all I'm asking.
Okay, okay.
Can I just say something?
Senator Klossmeyer.
Just for Senator Reedy. Senator Reedy? Okay. I just want to let you know that he has worked, this was not one of his, I came into session and worked on this. He's been working on this all summer long, and I think with the Oversight Committee has gone through it with him over and over. And, okay, I just want you to know that background.
Out of any sort of spite.
No,
I actually have a specific...
I don't think so. I understand that, but I just want you to know where it's coming from.
I agree there need to be changes, so I'm definitely not. But there's something I'd like to offer, and I confess I didn't see it until we got in here, so I'd like to do it. Okay, thank you.
And Senator Klossmeyer, are you saying that in the present posture in which Nathan has it, this is what the Oversight Committee also? Okay. Yes. Okay. All right. And all I would say for all of us is, I know we all have our special pieces, and I got mine too. There's nothing I got to see to be moving right now. But we have to realize that with crossover coming as closely as it is, if we want things to get across, we're going to have to get them in line. Okay.
The last Before we, sure. Before we break up, there are two withdrawals. The first is Senator Hayes' Senate Bill 753, and then the second one is from Senator Young, Senate Bill 552. Withdrawals.
Yes.
I would just like to say thank you to the House, the oversight work, and Nathan and Laura and Steve, because as I said, we have been working since even maybe in the spring, all year long, trying to solve our problems with this. So this is what we came up with, and I just want to thank them. Thank you. And it's been great working with the House when it was really made life a lot easier. So.
Okay. All right. So if we could hold on to you think we should hold on to the reprint you gave us on this Rosa Pep bill, and then we'll see what else you need.
I can provide another copy, and if Senator Reedy sends along his amendment ahead of the voting session on Thursday, I can incorporate it into a single reprint.
Okay, Senator Hayes and Senator Kramer.
No, Madam Chair, I just wanted to speak real quickly to the bill that is going to be withdrawn, Senate Bill 753. You know, we've been trying to communicate, and especially from the point of view of the Legislative Black Caucus, about the distribution of funds. I know Senator Reedy and a couple of us have expressed concern about some of the distribution being so prescriptive, but the department and Department of Commerce, kudos to the Secretary who's really, you know, listened to some of the things that have been brought to our attention, and also in working with Budget and Tax have, you know, used budget language to bring some of these to be true. But hopefully in the next round of funding, there'll be greater opportunities, especially as you relate to those smaller businesses. Earlier today, the testimony that was provided from the Anne Arundel County Economic Development Officer and others have shown us, like, the locals got it this round, right? And I think at the state level, there was a lot of people that was looked over, but the locals across the board, you know, in each county had some very successful opportunities at making sure those businesses that really needed the money got it, whereas, you know, some of the larger businesses, weren't just, you know, taking advantage of it. So I just wanted to publicly thank the Secretary for hearing some of our issues as it relates to this. And so I'm not one to just go ahead just for the sake of going ahead. I think the department has put together a good step forward, and so I see no reason to try to legislate and mandate them to do it.
Okay, I'm going to cut this off. All right, I want to thank you for a very efficient voting session.
We need to move and vote the withdrawals.
That's all right.
Just make a motion on
Move unfavorable on the withdrawn bill.
And
Do we have a second?
Senator Young's 552.
552 bill.
Okay. Okay, all in favor of the unfavorables? Okay. Okay. And then Senator Kramer, you have your light on.
Yes, Madam Chair, in light of the comments that you offered about how close we are to crossover, and this is the guillotine is starting to, come down a little bit. For those of us that have a collection of bills in the drawer, is there an opportunity to maybe see some of those bills end up on a voting list so that perhaps as close as we are now, this is it? So
I promise you it is all good. Yeah, you've got more bills out of here than anybody. Okay, I'm going to turn.
I hope that we can have that conversation, Madam Chair. Thank you.